Hi, I'm Dr. David Geyer, orthopedic surgeon and sports medicine specialist, and I provide commentary and education on injuries and injury treatments and injury prevention in sports and exercise for athletes and active people so that you can stay healthy and perform your best. I had somebody in my office and clinic earlier this week presented a really difficult problem. He was in his 70s, super nice guy, and very active. He had basically been playing golf and tennis just about every day for probably certainly the last few years and probably most of his life. But now he was coming in with really close to bone-on-bone arthritis changes in his knee. But he really didn't want to have a knee replacement because he wanted to stay active playing golf and tennis, which he really loved to do. And that gets to kind of a big picture problem going on in our society. We've got a population, an older population that's increasing in numbers, but they want to stay physically active, which is great. They want to potentially run, play golf, play tennis, do sorts of sports and exercise to stay healthy. But the problem with that is, as you get older, you're more likely to have arthritis, and that arthritis can not only make exercise and sports difficult, but it can impair your quality of life. And so a lot of these people get to the point where their knee arthritis or their hip arthritis gets so bad that potentially they need a knee replacement. But there are some concerns about hip and knee replacements in terms of basically going back to sports and exercise after. And so we have to ask ourselves, is it safe to go back and play sports or exercise after undergoing a hip or knee replacement? And if so, what choices do you make about maybe the type of exercise that you engage in or the type of sport that you play? So there's some points that I want to consider about joint replacement and going back to sports and exercise after joint replacement. First of all, the overarching concern is the wear on the components. Basically, a joint replacement, the surgeon removes the diseased bone and cartilage from the knee or from the hip and replaces it with metal and plastic. And that metal and plastic is certainly much better than the worn out bone and cartilage. You have less pain, but sometimes have a lot better range of motion, and yes, even better function. But that metal and plastic can wear out over time. If you basically keep pounding on it with something like jogging, that metal and plastic can wear out, and it can wear out faster the more aggressive the physical activity that you do. One of my colleagues is a joint replacement specialist. He does hundreds of these surgeries every year, and he compares this to tread on a tire. The more you drive on the car, and maybe the faster you drive, the faster the tread on the tire wears out. Now, what happens when those joint components wear out is you run the risk of needing a revision joint replacement, where they take out the worn out metal and plastic and put in a revision component, revision prosthesis. And that's a much bigger surgery, much more medical complications. It's much harder to get over. It's not to say that you can't, but it's much more difficult. And ideally, you'd like to never need a revision surgery. So by potentially pounding on it more, you potentially speed up the chance that you need a revision sooner, or at least increase the chance that you need a revision surgery. Now, with newer implants that come out, we think that those are going to hold up much longer, much better. I mean, some of the joint surgeons now talk about 20 and 25 year survivorship data with some of these new hip and knee prostheses. So while we used to just recommend maybe non-impact or low impact activities like stationary bike and swimming after hip and knee replacements, we're starting to get where we can recommend things like golf, things like doubles tennis, things like skiing, and maybe one day, yes, even something like jogging. Now, it's important to discuss these potential restrictions with your orthopedic surgeon, because a lot of times you can tailor your physical activities based on your age, based on any maybe medical conditions you have, the type of prosthesis that you have, and what physical activities you'd like to do. But it's so important that we do keep people active, because we know that physical activity is good for the health of the bone around the prosthesis, but it's good for overall physical health, cardiovascular health, and so many other medical conditions, but it's also important for emotional and mental health as well. Now, have you had a hip or knee replacement and you wanted to go back to sports and exercise, and were you able to do it? Or are you about to undergo hip or knee replacement and have concerns about whether or not you can lift weights or play golf or tennis or ski? I would love to hear your thoughts. So below this video, leave your comments and basically share your thoughts with me on this issue. I mean, do you desire to get back to a really demanding physically active lifestyle? I'd love to hear from you. If you like videos like this and want more information on injuries and injury treatments and injury prevention in sports and exercise, I record one of these videos about once or twice a week. So subscribe to my video channel and you can get more videos like this sent directly to you. If you have friends that are about to undergo hip or knee replacement, share this video with them. I'd be really appreciative, and I think that this could get them thinking and maybe encourage them to talk to their orthopedic surgeons. So yeah, definitely share that with them. Finally, if you want more resources on ways to stay healthy and perform at your best in sports and exercise, go to my website, drdavidgeyer.com. Right at the top, there's a sign-up list where you can enter your name and email, and basically for free, I send resources, I share resources about staying healthy and performing your best that I only share by email. Thank you so much for watching. I hope this was helpful. Again, if you have thoughts on exercise and sports after hip and knee replacement, share those with me, and I look forward to seeing you right here next time.